Hello guys, welcome to My Oral Health Diaries, episode 3. In this episode, we're going to be focusing on oral hygiene. In our tenets of oral health, we clearly just put oral hygiene as number 1. So before we go into, what we have prepared today about oral hygiene, let's just do some history, check or like a background of where oral hygiene started or what used to happen a long time back when there were no toothbrushes, when there was no floss. What did they use to clean their mouths with? Now, people have this theory that a long time ago, there was no great need for serious oral hygiene due to the lack of processed foods, which might be the case. But there's been quite a lot of findings that there actually used to be oral hygiene practices that were practiced in the past. The most interesting one being that people used to crush eggs, oyster shells, and they would scrub their teeth with that so that they can achieve clean teeth. There's also a time where they used feathers to clean between their teeth. And feathers are so light, but they put effort into it. There's also history about using the hog hair as things for brushing. And actually this hog hair and bone is what formed the basis of toothbrushes that we now see today. Just a random fact before we dive into our oral hygiene for today, where we're going to be focusing on toothbrushing. Long time ago, there actually used to be a specific cohort of individuals who believed that kissing a donkey would take away your tooth pain. So just putting it out there and asking us, would you kiss a donkey to take away your toothache? Back to today's topic, toothbrushing. So today we are focusing on toothbrushing as a basic element of oral hygiene. Toothbrushing is key. It is very important because it is the only proven mechanical way of removing plaque from your teeth. I'm going to just go and define plaque a bit so that we all have a deeper understanding of what we are talking about when we talk about plaque. So when you eat, there's the food that kind of just remains in your mouth, and then there's the lining in your mouth has epithelial cells that are falling off, so that there's that rapid turnover of the epithelial cells. There is still saliva that has protein. So when you eat, just thinking about it, what happens next is that if you've not brushed, these things form something we call food debris or material alba. Then over time, if after 48 hours, it has not been disrupted or interfered with, then it becomes plaque. Plaque is essentially like a sellotape on both sides, so it's kind of attached to your teeth, and then on this other side it is still attracting more plaque onto itself. Plaque is bad because this is where the bacteria that causes decay is harbored, hence the importance of toothbrushing. Toothbrushing is the only means that can actually remove this plaque from the surfaces of your teeth. So toothbrushing being the only mechanical means to remove this layer of plaque, we are going to be taking a deep dive on toothbrushing. So today we have quite a number of demonstration aids that are going to help us just understand the concept of toothbrushing. Before I do a quick demo, I'm just going to explain what exactly we should be doing with our toothbrushes. Now, first of all, yes, you need to own a toothbrush. A toothbrush is very, very important. You can either choose to have a manual toothbrush, which I have here, okay? And you can also choose this, an electric toothbrush. The only difference between the two is that in one, you have to actually manually, with your hand, take the toothbrush around your teeth to remove the plaque. Using the other electric toothbrush, you just need to take the brush, to the tooth, and the brush will do the work for you. Ideally, we encourage that we brush our teeth twice a day. Sometimes when you visit your dentist and they notice that you have high plaque levels, they may advise you to probably brush more than once a day. But we advise that you brush twice a day, in the morning and in the evening. Now, in the morning, we advise that you brush after your breakfast so that you're able to remove the debris from the breakfast that you've just had, and you can have a day with, just a clean mouth. However, if you experience a lot of acidity, or you're going to have a breakfast with a lot of acidic content, maybe like oranges, orange juice and such acidic substances, then you may choose to brush before. It is just for you to make that decision based on what you're going to expose your oral cavity to. So we are brushing in the morning and also in the evening. In the evening, you brush just before you go to bed. So you don't want to eat anything or drink anything afterwards, because then this material that you take afterwards is just going to be randomly idling in your mouth, and the sequela continues, and you're just promoting plaque formation on your teeth. So you really need to be keen, especially at night, because that's the time saliva is just kind of idle in your mouth. At least during the day, you're talking and you're moving around. So there's this kind of rinsing of your mouth by the saliva, but at night it's stagnating, so it's more dangerous. So we are brushing twice a day. Now, for the toothbrushes, if you get your toothbrush, you need to change your toothbrush after every 3 months. After every 3 months, you get a new toothbrush, whether you're using a manual one or an electric one. This one of mine is due for changing, but if you're using the electric one, you need to change the heads, so that after every 3 months you're having new heads, just because of the activity. Now, when you're brushing, frequency and what do we say? We want you to brush using the correct technique. Technique just means that you're really trying your best to get all the areas around your teeth. And how do you make sure you're doing that? Now, this is something that people don't probably know about, but I've brought samples just to show. And this is a packet of something we call disclosing tablets. Disclosing tablets are just tablets that have dye that can attach to the plaque. So when you have plaque and you chew these tablets, then the plaque is going to be colored. So that's how you know where the plaque is. If you visit your dentist, the dentist may give you a tablet to chew. So you chew on the tablet. Maybe I'm going to open and just show a sample of how it looks like. They just look like they look like Actol, kind of like, but colored Actols. So you just chew on one and then you apply on the surfaces of your teeth using your tongue. I'm not going to chew one now because maybe my mouth is going to just become purple. But this is a good assessment just to check, You wouldn't go to school and study and you don't take exams, then you wouldn't know how you're progressing. So these disclosing tablets are available. If you can, talk to your dentist, just let them know that you would like to assess yourself, then they can hook you up and get you some of these disclosing tabs. For children, you may not want to give them the whole tab. You may want to probably smash the tablet, and then from the solution, you can use something to just wipe on their teeth to see where the plaque is present. So we just chew the tablet slowly. You take your time, like 1 or 2 minutes, and then you apply on all the surfaces of your teeth using your tongue. Take about 2 minutes, and then you can spit out the excess. Once you spit out, you're now able to see your teeth, if there's actually any stain. It seems I am doing a very good job. There are no stains. There were very few areas where there were stains. But if there is plaque present in your mouth, then you'll be able to see a heavy, like blue or purple layer, like colored area. So it's easier to identify the areas that you're not brushing very well. Now, onto the technique of toothbrushing. When we are brushing our teeth, as we've said, the most important thing is technique. You want to be brushing the correct way, and just, taking your time to make sure that you're actually getting the plaque out. So our oral cavities kind of look like this. This is just a simulation, but I believe it's going to help us do our demo. So our mouths are here, and you have your toothbrush. In this case, I'm going to be demonstrating using my manual toothbrush because I believe that's what most of us have. You may choose to either open your mouth when you're brushing or just, keep your mouth closed but bite using your front teeth so that all your teeth are exposed. Then you can put your toothpaste Of course, fluoridated toothpaste. We are going to discuss why fluoride is important in your toothpaste and how to make sure you're choosing a correct toothpaste that works best for you. So after you've put your toothpaste on your toothbrush, an acceptable amount, of course, you don't have to put your toothbrush to run underwater because then you're diluting the fluoride. What I prefer to do is after I put my paste on the brush, I kind of like I just smear the teeth with the paste all over, and then I start brushing after. So after I smear them, then I brush, I bite using my front teeth, and then I take my toothbrush and brush in light circular motions. So you're really doing it lightly. You don't need to press your toothbrush so hard. Plaque is not a hard substance. Essentially, when you think about it, it's like a mixture of a cereal. So we are saying to brush lightly because it'll just come off. But what happens over time, just the same way you can leave a cereal bowl out and then the cereal kind of hardens and attaches to the tooth, that's the same thing that happens. But if you're brushing regularly, you don't need to apply pressure because then the pressure can cause tooth wear and it can also kind of strip the gum away. So light forces as we are brushing. And you need to check on the bristles of your brush. They should be smooth. When you run your finger, they should actually bend a bit. They shouldn't be so tough. They're just eroding your gum line. So, a medium bristle toothbrush or a soft bristle toothbrush would work, taking it in round circles all over. You start from the back and you make sure you're touching every part of your teeth as you come forward. When you finish with the outer surface, you can now open your mouth and just scrub. The chewing surfaces, we just scrub. We have no issue. There's just scrubbing. Now, these surfaces, the inner surfaces, are the surfaces that most people do not brush properly. So you will see the way I'm holding my toothbrush. I'm kind of holding the model close to my mouth so that you can appreciate. So the toothbrush goes all the way to the back, and then you can sweep the teeth just like this, gently. From the gum, you need to kind of massage the gum and then come up slowly. Then when you come to the canine is this tooth here at the corner. You just want to sweep like that, or you can brush slowly if you have a toothbrush with a small head. If your toothbrush is a bit wider, then you may prefer to sweep. Same thing on this side, same thing for the upper teeth. Once you're done with your teeth, you make sure you stick your tongue out and try and scrape out the dirt from your tongue. If you can afford, you can get a tongue scraper to just brush your teeth, or there are some toothbrushes that come with a section at the back that helps to clean your tongue. After that, what we advise is you either spit. If you can handle the paste you're using, just spit and leave your mouth like that so that you don't rinse away the fluoride. When teeth are in the mouth, the fluoride that matters or that helps to prevent cavities is the fluoride that you're actually applying. So that's why we're saying we have to use fluoridated toothpaste. So you either spit just once or rinse once. So a moderate or little amount of toothpaste applying, not rinsing so thoroughly to the point that you actually go back and brush again with your teeth. This just is counterproductive because then you're removing even the fluoride that you've placed on your teeth. We are recommending that we rinse lightly because we need to maintain the fluoride deposit on the teeth. The way fluoride works on the teeth, it has to be in contact with it. So once you've brushed and if you rinse very aggressively, then you wash out all the fluoride, but we need the fluoride. So light rinsing or just no rinsing altogether would work best. There are so many instructions and so many videos on how to brush properly, and even your oral health care provider can assist you to do a good job. So for today, I just wanted to do some highlights and just a quick overview of toothbrushing. We will continue discussing oral hygiene, but basically if you can get a proper toothbrush, change your toothbrush well. Oh, before I forget, storage of toothbrushes. When you brush and after you rinse your toothbrush, it would be nice to store it in an enclosed space where it's not very open, but make sure that you're keeping your toothbrush very clean. Once in a while, you may choose to, kind of soak it in some warm, salty water to just make sure it's still clean. Yes, so as I said, there are many areas where you can get more information about toothbrushing, if you need some more information, just enlighten yourself. You may also ask from your healthcare provider, and they will be able to explain to you what works best for you, which toothbrush works best for you. We are not in a position to tell you this is the toothbrush, because different people have different needs. Therefore, it would be good to always seek clarification from your oral health care provider. I prescribe toothbrushes for my patients when I see their need. When I assess your teeth and I see you're not brushing here and here, probably you need a flexi, yeah? Or maybe you're being too rough on your gum. So I tell you, get a toothbrush that has rubber bristles, you know. But that's after assessment. In the process of carrying out your oral hygiene, you may be wondering, should I brush my lips? Should I brush my cheek? Should I brush my palate? The palate is this part over here, the top part of your upper jaw over here. My opinion would be that, you know, this we call this a toothbrush. So it is meant to brush your teeth. There are other forms of cleaning that you may use as aids to make sure that you're now cleaning other parts of your oral cavity where there are no teeth. And we are going to be discussing this during our next discussion. Thank you so much for joining us on today's episode of My Oral Health Diaries. I hope you learned something, and I'll see you again next time when we discuss oral hygiene aids. We'll see you. I feel like I've talked. Yeah, there's like so much about toothbrushing. And I didn't even talk about the chewing stick. Msimuhovero na nini zako. But that's the term for it, mswaki. Sorry. Yeah. Sini uliambia ati ningenunua mhovero, niko like ala. Yes. Interesting. How are we doing so far?